for coming in today. Today, what I'm hoping to do is share some major accomplishments from fiscal year 24 and also tell you about some new opportunities that are on the horizon. Okay, let's start with some major highlights from last year. So Caitlin is definitely a major highlight from last year. So for those of you who don't know or haven't heard, this past year, InCHIP welcomed a new Associate Director, Dr. Caitlin Caspi. Caitlin has been an InCHIP PI since joining UConn in 2020. And she joined UConn as an associate professor in the Department of Allied Health Sciences and the Red Center. Caitlin is a leading scholar in the field of food insecurity. Her research has been continuously funded by the NIH and other agencies throughout her career. In her role at InCHIP, Caitlin will lead community-engaged research initiatives and lend her expertise to research development efforts in faculty training and mentorship. So if you haven't had the opportunity to welcome Caitlin, please do so today during our night. So as many of you know, InCHIP continues to be one of the largest, most vibrant research institutes at UConn. We are home to 126 talented PIs, many of whom are leaders in their fields, and these PIs represent 15 different units across campus. InCHIP is also the home to 4 distinguished research centers, including ARMS, led by Carrie Racine, the Center for Health and Social Media, directed by Sherry Pagoto, the Collaboratory on School and Child Health, co-directed by Sandy Shafoulias and Beth Russell, and the Red Center, directed by Marlene Schwartz. So let's get right into the numbers, because that's often the first question a lot of people ask. Wonderful news in that we had another record-breaking year at InCHIP. Total active grant dollars hit an all-time high at $114 million, and this is the highest total active grant dollars in InCHIP's history. So who is funding these awards? InCHIP managed awards are funded by a variety of sources, of course, predominantly the NIH, but also the NSF, the DoD and DOE, the Centers for Disease Control and Prevention, the Connecticut Office of Early Childhood, the Department of Health and Human Services, the USDA, and the Robert Wood Johnson Foundation, to name a few. This total level of funding represents 151 active grants from 15 different units across UConn. It's also important to note that InCHIP PIs supported 83 graduate students for over $1.6 million in funding this year. InCHIP also had a record-breaking level of new funding in fiscal year 24, with $27 million in new grants. More important than the dollars that these grants generate are the lives that they improve. We have thousands of research participants living in Connecticut, throughout the United States, and across the globe whose health has been improved by being in our research studies. Specifically, new awards this year focus on critical public health areas such as occupational health and safety, aging, school and child health, mental health, and HIV and substance abuse. Additionally, we have new active awards in the areas of weight management, gun violence, food and nutrition, and advanced health research methodologies. In addition to the major public health impact, InCHIP has a rapidly expanding media footprint. InCHIP researchers are leading the narrative in the areas of their expertise with over 1,400 media mentions this year in major outlets such as the New York Times, the Washington Post, NPR, USA Today, and also in important local outlets such as the Hartford Courant. While our external funding and public health impact is incredibly strong, in fiscal year 24, InCHIP's internal funding has also been robust. We funded 13 faculty across 9 disciplines with approximately $114,000 in seed grants. I think I'm missing a slide. Okay. That's okay. I will speak off my notes. So in partnership with the Gladstein Family Human Rights Institute, InCHIP funded a critical project on health equity, human rights, and social justice approaches to health. Awardees were Ryan Talbert, and Raja Staggers Hakim. I just butchered that, I apologize. Ryan Talbert and Raja Staggers Hakim from sociology. And their project is entitled Mental Health Among Black Americans and the Local Commemoration of Anti-Black Violence, Black Figures, and the Black Freedom Struggle. Congratulations, Raya and Raja. The other major event that we hosted at InCHIP was the Health Disparities and Chronic Disease Networking event. And this event brought together interdisciplinary researchers from 13 different schools and departments, including UConn Health and Connecticut Children's. And they came together to develop new collaborations and share their research. And as a result of this event, InCHIP funded a Health Disparities and Chronic Disease seed grant, and the winner of this grant was Yumin Park from Geography and Marsha Ma from Communications. The title of their award is Promoting Awareness of Air Pollution Among Latino and Hispanic Communities Using Low-Cost Mobile Air Sensors and Culturally Tailored Health Messages. The other major networking event that we hosted was the methodology networking event, and the goal of this event was to bring methodologists from across UConn in order to connect with intervention scientists and share their expertise, and in doing so, identify areas for robust new collaboration. And this event was also followed by a methodology seed grant for new collaborations and new connections. Another major event that we focused on this year was the NIH Grant Writing Reboot Camp. And so historically, InCHIP has focused on NIH grant writing, an NIH grant writing seminar. But this year, we wanted to really focus on those applications that didn't get funded the first time around and guide and usher early stage investigators and even mid-career investigators into resubmitting those promising proposals. And so we brought together people from all over the campus and UConn Health and Connecticut Children's, and we were able to bring PIs from across UConn in order to give them critical tips in terms of how to revise their applications. And fortunately, we also saw several of these applications being ushered across the finish line for resubmissions. We were delighted to see the success of this particular initiative. The media training for UConn faculty that we've engaged in over the past year has provided researchers with successful strategies for enlisting media attention and ensuring accurate reporting. Specifically, we've really made initiatives at InCHIP for our investigators to augment and amplify their research findings. And in doing so, we've provided various trainings where we've brought together people from media specialists from across campus and trained researchers in how to be more effective at promoting their research, at answering interview questions, and at connecting with reporters. We also held a very effective workshop on engaging with the legislative process, in which we brought together expert panels, Foster, Racine, and Schwartz. So Jamie Foster is a state representative from the state of Connecticut. Carrie Racine is associate professor and director of ARMS, and Marlene Schwartz is director of HDFS. And they all have deep expertise in connecting with policymakers and developing more evidence-based policy. And the goal of this workshop was to cultivate relationships with policymakers at state and federal levels and leverage public hearings to promote evidence-based policy. And we had 36 attendees from across UConn and UConn Health and Connecticut Children's Hospital who participated in this event. And this event was followed by the Moving Beyond Implications Conference. So the Moving Beyond Implications Conference is new to Connecticut and new to UConn. And InCHIP co-sponsored this event. It was led by State Representative Jamie Foster and Carrie Racine, and it convened UConn researchers and Connecticut legislatures to share their expertise and to provide information and data on how to develop in the development of more evidence-based policy across Connecticut. And it was an incredibly successful event, and we're really looking forward to actually redoing and having our second inaugural event this coming year. And Jamie Foster and Carrie Racine will also be spearheading the event this year. And the last piece that I want to mention is the fiscal year 24 InCHIP lecture series. We had experts from across the country in various areas, such as racism, health disparities and its effect on health, cardiovascular disease, sleep, women's health, and they either came to UConn or participated virtually with all of the faculty across UConn and UConn Health. We had over 450 people who attended our events, and we also publish our events on YouTube, and we had over 800 YouTube views. And I want to thank the departments and units that sponsored this event, including Allied Health Sciences, Anthropology, Human Development and Family Sciences, Nutritional Sciences, Public Health Sciences, School of Social Work, and the School of Nursing. In fiscal year 24, InCHIP funded 13 faculty across 9 UConn schools and departments for a total of $114,000. Specifically, in partnership with the Gladstein Family Human Rights Institute, we funded, as I mentioned, Ryan Talbert and Raja Staggers Hakim from sociology. I think this is the slide that got misplaced, so we're going to revisit this slide, but nonetheless, big congratulations to Ryan and Raja. InCHIP had another new funding opportunity last year, which focused on the environment and health. The recipient of this award was Cindy Zhang from Geography. Cindy's project will examine the impact of climate change on health behaviors. Excuse me. Our core faculty seed grant program also funded 4 exciting projects, which will focus on social deprivation, neuromodulation and recovery from stroke, suicide among sexual minority men, and pain management among breastfeeding women receiving services from WIC. We also resuscitated our community engaged program and had, with Caitlin's expertise and also with our collaborators across UConn, Kim Gans and Kristen Cooksey Stowers, we were able to fund 3 new community engaged research projects. The first was led by Mia Maltz, which focuses on air quality and health. The second, led by Eileen Carter, will focus on children's access to penicillin allergy evaluations. And the third InCHIP funded community engaged research project will focus on improving treatment for opioid use disorder. This project was led by Megan O'Grady. I also want to note that for every $1 distributed in InCHIP seed grants, $30 is recuperated in external grant funding, which is a really amazing return on investment. And it's so wonderful to see that our PIs who receive these seed grants are actually then turning this pilot funding into external awards. The last major fiscal year 24 highlight I'd like to share with you today are our Excellence Award winners. We have 2 awards for graduate students. The InCHIP Dissertation Assistantship Award funds 1 doctoral student through the completion of their dissertation. The fiscal year 24 award winner was Madeline Baird. Madeline's research project is entitled Embody Borders and Migration as a Social Determinant of Health. The second InCHIP Graduate Student Award is the Jeffrey Fisher Health Behavior Change Research Fellowship Award. This prestigious award was given to doctoral student Richard Banner for his important research on CVD prevention among African immigrants in the U.S. I would also like to share with you our faculty award winners. Neil Glaviano was selected for InCHIP's Junior Faculty Research Excellence Award in recognition of his important work examining the role of strength training in rehabilitation and recovery from knee pain. Neil is here today, so if we could take a moment and congratulate him. InCHIP's Excellence Award in Health Disparities went to Christina Ross from the School of Nursing. Christina is conducting groundbreaking research on health equity and sexual reproductive health among vulnerable populations of color. Christina, if you're here today, please stand up. Okay. Our Community Engaged Health Research Excellence Award went to Shana Cummingham from Public Health Sciences. Shana's research has made important contributions to improving health equity in maternal and child health for marginalized populations across Connecticut and the U.S. Finally, InCHIP's Excellence in Faculty Mentoring Award went to Amy Gorin. Amy is currently Vice Provost for Health Sciences and Interdisciplinary Initiatives and Professor of Psychological Sciences. She is also former Director of InCHIP. For decades, Amy has provided generous mentorship to faculty and students. Her mentees have gone on to secure NIH funding and other external awards. Importantly, Amy has had a strong and impactful history of mentoring individuals who have been historically underrepresented in the academy. A tremendous thank you to Amy from the InCHIP community. For additional details on fiscal year 24 and for additional InCHIP highlights, please see our InCHIP annual report, and you can either access it through the QR code here or via our website. I'd now like to switch gears and take a few minutes to share some important opportunities offered by InCHIP in the year ahead. This year, we will be offering several networking events, trainings, and workshops. Earlier this fall, InCHIP hosted the Community Engaged Research Roundup, where InCHIP PIs and affiliates gathered to share their perspectives on the strengths and areas for growth in community engaged research at UConn. If you are unable to attend, keep an eye out for follow-on community engaged opportunities in the months ahead. Excuse me. At the end of October, InCHIP will be participating with the Office of Global Affairs to host a networking event with colleagues at Ono College in Israel. The event will bring together experts at UConn and Ono to help address trauma resulting from the Israeli-Palestinian conflict through clinical research initiatives. Also this month, InCHIP will be hosting a workshop on how to write effective policy briefs. This workshop will be in advance of the second annual Moving Beyond conference. And this conference will take place again in downtown Hartford in December. The conference will provide a platform for policy-relevant researchers to dialogue with Connecticut legislatures to develop more evidence-based policy across Connecticut. And again, InCHIP will be co-sponsoring this event. Then in the spring of 2025, InCHIP will host our NIH Grant Writing Bootcamp. This is open to investigators at all levels across UConn. It will be a very intensive workshop, a one-day workshop followed by ongoing mentorship throughout the academic year in small groups and with peers. And we'll round out the year with a women's health networking event, which will be followed by a seed grant opportunity focused on women's health. In terms of internal funding ops coming forth through InCHIP, this year we'll be offering several funding opportunities in the area of women's health, as mentioned, health equity, human rights, and social justice in partnership with the Gladstone Family Human Rights Initiative, environment, climate change, and health. In addition, we will continue to offer our core funding opportunities in community engaged research, seed grants, and faculty development and project completion initiatives. There are 2 deadlines for these particular awards, one coming up this fall and the other in the spring. So if you're interested, please keep those in mind. InCHIP will also support 2 graduate student funding opportunities, the Fisher Fellowship and the Dissertation Assistantship Award. Finally, I'd like to highlight our 24-25 lecture series. We're offering lectures this year on a variety of topics, as you can see here. I also want to take this time to acknowledge the generous support of the lecture series from several units, again, across campus, across the university. Without their support and their ongoing contributions, this would not be possible. And I want to end and close by acknowledging all that the InCHIP community does to support these important initiatives, including providing mentorship, helping to deliver workshops and trainings, reviewing grants, and driving our community engaged in research and policy efforts. Without you and without your commitment to InCHIP, this would not be possible. I also want to thank you for, and our team for all the expert, hardworking efforts that go into managing our grants at both pre and post award, research training and development, and constant ongoing mentorship of InCHIP faculty, and also all of our communication efforts that have led to a real significant increase in the InCHIP footprint across media channels. And finally, a big congratulations to all of InCHIP PIs and centers for an incredibly successful year of innovation and high impact research. it's really delightful to see you all here today. I appreciate you taking the time again to come out and participate as in InCHIP's annual meeting, and also to continue to build as a community through the networking event that's about to follow. But before we transition to the networking event, I also want to provide a platform for potential questions, discussion, in case anybody has anything on their mind. Okay. All right, well, thank you all for coming. Thank you for your contributions, and I look forward to seeing you downstairs for light refreshments.